So this is the fifth anniversary of your book, The New Health Age. So for the listeners, what does the new health age mean to you? What does this mean?
The new health age is basically a whole new era of how we think about healthcare, how healthcare is delivered, and the economics of healthcare.
So who is this book written for? Is this pretty much anybody, and anybody can read this book and get stuff out of it?
Absolutely. My passion is to help individuals, businesses, communities to move into the new health age. It's really targeted for not just the United States, but the new health age message is also going global. We talk a lot about examples in the book of forward thinkers and how the new health age is really changing the world. If you look at the 20th century model of healthcare, it was really a model that was focused on sickness. It was not a model that was developed to keep us all well. If you think back even 5-10 years ago, when most of us thought about going to the doctor, we thought about going to the doctor when we were sick. How many of us 5-10 years ago, and certainly through most of the 20th century, thought about going to the doctor to find ideas about wellness and finding methodologies and things to do to prevent getting sick and injured, and those types of 20th century realities of where healthcare was. So I think part of what the new healthcare is about is changing that mindset to really viewing healthcare not just as a sick-based system, but as a wellness-based system. And I think you're starting to see a lot of changes in businesses and governments and policies where we're really starting to view healthcare around health management, because it is more about being proactive, being preventative, and focusing on wellness.
Where did you get it right in this book?
Certainly the dynamic flows that I've been referring to, how we think about healthcare is changing in the new health age, how we deliver healthcare is changing in the new health age, and the economics of healthcare are changing in the new health age. A few examples. Speaking of sickness to wellness, Medicare, certainly big in the state of Florida and areas where retirees are heavy in population. We have 10,000 baby boomers becoming Medicare eligible a day now for the next 20 years. 5 years ago, Medicare didn't even cover annual physical exams. Imagine that. One of the largest government entitlement Social Security programs in the world, and certainly in the United States, didn't cover annual physicals. Well, now they do, because we're focusing more on wellness. There's lots of studies out there that demonstrate and prove that to have an engaged workforce increases profits in some cases by 10-20% for a business. What better way for companies and businesses in Florida, in America today, than to increase profits, but to have employees who are more engaged? Mm-hmm. How do you create better engagement? Get your employees excited about health, wellness, and being healthy. And another benefit behind the employee engagement as well is you reduce absenteeism. They show up to work more. When they are at work, they're happier, they're more productive. And a huge benefit as well is that your healthcare costs, your healthcare insurance expenses go down as well.
In studio with Jonathan Fleece, and he is the author of The New Health Age. And Jonathan, you wrote this book, and it actually inspired you. Tell us the story.
Yeah, so as I mentioned at the top half of the show, I've been a healthcare lawyer for nearly 20 years, helping entrepreneurs, healthcare businesses, physicians, professionals, pretty much every segment of healthcare. Wrote the book about the new health age, talking about how in the 21st century, how we think about healthcare is going to change towards wellness, how we deliver healthcare is going to change towards prevention, and how the economics of healthcare are going to change around paying for performance. But one day I looked in the mirror, literally, and discovered and realized and admitted that, you know what, was not a healthy person. I had pre-metabolic syndrome, and if you don't know what metabolic syndrome is, it's basically just all those core health measures that measure our health. High blood pressure, high blood sugar, high BMI or body mass index, high cholesterol, and other basic measures. And I witness a guy in his early 40s who was incredibly unhealthy. So I started to really change that about myself, and that's been one of the huge rewards of the new health age, and what's happened over the 5 years since the book came out is really becoming a healthier person. And I focus in really three areas: healthy mind, healthy body, healthy soul creates healthy being. When I look back on my own journey over the last 5 years, I really started, as I mentioned a few minutes ago, about creating a healthier body. But you know what? That just didn't do it for me 100%. So I started thinking about, well, what else was not in balance with Jonathan Fleece? And I started thinking about a lot of the mind components. You know, am I a lifelong learner trying to grow and change, or am I stuck in the mud and not trying to really evolve as a human being? Do I think positively or do I think negatively? And fortunately, through that journey, I really embraced creating a healthy mind, positive thinking, learning constantly, recognizing that we're on a journey throughout life, and we can grow mentally. So I certainly learned that the mind was part of that, because I think in order to truly create the new health age, as I know it is coming and I know it is here in part, Americans and humans across the planet and the world need to be really thinking about creating healthy minds, healthy bodies, healthy souls to be healthy beings.